Approximately 795,000 adults will suffer a first or recurrent stroke, about one every 40 seconds. Now, there are risk factors such as hereditary that play a part in that, but there are steps that can be taken to lower your risk of this devastating disease. Joining us from Martha Jefferson HealthWise is Dr. Alex Grunsfeld, Director of Stroke and Neurocritical Care, to share information on stroke risk factors and how we can stay healthy. Thanks for joining us tonight.
Thank you for having me.
Well, first of all, what risk factors for stroke can't be changed?
Well, the most obvious one is age. We know that for every decade after the age of 55, the risk of stroke approximately doubles. A family history of stroke is also a risk factor. If an immediate family member has had a stroke, that increases your risk for stroke as well. Men have strokes more often than women. And finally, if you've already had a stroke, or a TIA, that's a transient ischemic attack, a period of temporary stroke symptoms that resolves on its own, then your risk for having a second or recurrent stroke also is increased.
And what are risk factors that we can control to help keep our risk of stroke lower?
Well, smoking is an important one. We know that smoking doubles your risk of having a stroke. If you stop smoking, that risk is reduced, and by 5 years of smoking cessation, that risk is about the same as someone who has never smoked. Control of blood pressure is possibly the most important risk factor that you can have an impact on. Control of blood pressure through exercise, diet, and if necessary, medications can reduce the risk for stroke by about 40%. Diabetes is a disease that has both direct and indirect effects on your risk for stroke. The indirect effects are due to their association with high cholesterol and high blood pressure.
Okay. And we hear that aspirin can possibly help. What other medications can help reduce our risk of stroke?
Well, yes, in fact, a full dose of aspirin is important to take if you've already had a TIA or a stroke. If you have an abnormal heart rhythm, an arrhythmia called atrial fibrillation, this increases your risk of having a stroke, as this allows clot formation in the heart that can then travel to the brain. In some cases, taking medicine that will thin your blood called warfarin, otherwise known as Coumadin, can reduce the risk for having a stroke.
And aside from medication, how about surgeries or anything like that?
We know that the arteries in the neck, the carotid arteries, are a common place for buildup of an atherosclerotic plaque. If this buildup is severe, it can increase your risk of having a stroke, especially if you've already had a TIA or a stroke on the affected side. In some cases, if the atherosclerotic plaque is severe enough, surgery to remove the plaque can reduce the risk of having a stroke.
Okay, so there is help out there through medication and possibly some surgery here.
Absolutely.
Okay, well, thank you so much for joining us tonight.
Thank you very much.
And for additional information on resources that are available for you, just visit our web channel at wcav.tv.